evening, or good afternoon, whichever one you prefer. This is Mayor Baraka, and welcome to our daily COVID-19 update. Our daily COVID-19 update every day, Monday through Friday, I should say, at 5 p.m. I want to thank all of the people for signing in and watching us every day, 5 p.m., Monday through Friday, coronavirus update for you, sometimes on Saturday as well. Shout out and thank all of the people who've been doing what they're supposed to do. Just want to wait a little while, get a few people on right away. Good evening, Gladys. Good evening, Miss Santana. So I want to go refer to this article, how some cities flattened the curve. I don't know if you can see that, how some cities flattened the curve. Forgive my writing on it, during the 1918 flu pandemic. How some cities flattened the curve during the 1918 flu pandemic. That is from National Geographic. There are about 4 or 5 articles on there. If you can stand subscribing to National Geographic, do that. And you can read a series of articles that they have on the Spanish flu and its relationship to the coronavirus and some of the things that were going on then and are going on now. And I keep repeating that because it gives you some kind of context and some perspective on what's happening. So you're not just in the dark on what people are doing, what they're asking you to do. You don't think this is some convoluted stuff that is coming from out of the air that people are making up. These are real scientific methods that have been put together that have worked in the past with less technology and less resources than we have today. Just a small excerpt from that article that I would like to read and share with you. It says in 2007, a study in the Journal of the American Medical Association analyzed health data from the U.S. Census that experienced the 1918 pandemic and charted the death rates of 43 U.S. cities. That same year, 2 studies published in the Proceedings of the National Academy of Sciences sought to understand how responses influenced the disease's spread in different cities. By comparing fatality rates, timing, and public health interventions, they found death rates were around 50% lower in cities that implemented preventative measures early on versus those that did so late or not at all. 50% difference between those cities that implemented measures and those that did nothing. The most effective efforts had simultaneously closed schools, churches, and theaters and banned public gatherings. This would allow time for a vaccine development, though a flu vaccine was not used until the 1940s, and lessened the strain on healthcare systems. The studies reached another important conclusion, that relaxing intervention measures too early could cause an otherwise stabilized city to relapse. St. Louis, for example, was so emboldened by its low death rate that the city lifted restrictions on public gatherings less than 2 months after the outbreak began. A rash of new cases soon followed. Of the cities that kept interventions in place, none experienced a second wave of high deaths. None experienced a second wave of high deaths, right? In 1918, the studies found the key to flattening the curve was social distancing, and that likely remains true a century later. People did in 1918, the social distancing worked, and the cities that took longer to enact social distancing actually had more death rates. In fact, there was a 50% difference in death rates between cities who acted late or not at all versus cities who acted early, right? So please bear with us that though we see numbers increasing every day, and I'm going to read the numbers, you'll see numbers increasing, you'll see death rates increasing, but what you'll also begin to see and what's happening is that they're not increasing by the same numbers. So while it's increasing, the numbers will go down slightly in the amount that it's increasing, right? Which means that we are beginning to experience some sort of flattening, right? And so the important thing is that we continue to do what we're doing as long as we possibly can until not just that we see a flattening, but we see a downward trend, So we in this until it happens. So I want to tell you what the death rate looks like. So per 100 people in a state that get coronavirus, per 100 people, about 4% of those people die. About 4% of the people who contracted coronavirus out of 100 actually die, right? In Newark, however, in Newark, that number is 6%. That number is 6% in Newark. In Newark, out of 100 people that get the coronavirus, 6% of those people die. So we're at a 2% percentage points higher than the entire state. So those 2 percentage points you may think are small, but those represent a lot of numbers of people who are perishing because they live in conditions on top of each other. They have poor access to health care. They have poor access to healthy food, not exercising as much, suffer from other diseases like diabetes, high blood pressure, hypertension, all of these things, which is the same thing, high blood pressure, hypertension, diabetes, other kinds of heart diseases, emphysema, asthma, upper respiratory illness, HIV and AIDS. All these diseases add to our likelihood that we will die or perish from getting the coronavirus. And most of that is deeply embedded in the inequity that's already in our system, right? And so we have to account for that. And so the measures that we take have to be a little bit more stringent, right? We have to be a little bit more disciplined than everybody else. We have to be a little bit more effective in what we're doing. So here's the good thing. Here's some good news about what we're doing. Here's some good news about our ability to follow instructions, because I know people think nobody is out there listening, and that's just not true. So here's the survey. I hope you can see it. Survey I'm putting up that was done. It's not a survey. It's a mobility report put out April 5th, 2020 by the state of New Jersey. It says, in terms of retail and recreation, for places like restaurants, cafes, shopping centers, theme parks, museums, libraries, and movie theaters, the state is down 66%. Essex County, however, is down 68%, right? Grocery and pharmacy, that's all of this argument about why we closing the grocery stores on Monday. The state is down 11%. In the mobility rate. That means that people that are going to these stores, that are out just going to grocery stores, supermarkets, pharmacies, all these places are down 11%. In Essex County, we're down 20%, right? 20%. That means that more of us are staying home. Let's look at this. Parks. Now here's the real killer. Parks. Mobility trends for places like national parks, public beaches, marinas, dog parks, plazas, and public gardens. The state actually went up 26%. So even in the middle of the pandemic, more people are going out to the park, more people are doing this and doing that. And though we've had people at Branfield Park and all these other places, and we've been cracking down on them, guess what? Essex County is down 21%. So while the state is up 26%, Essex County is down 21%, right? Transit stations, that means that us going, taking a train and catching the buses. So the state is down 67%. Essex County is down 79%. 79% in Essex County. And that's big because most of our folks actually take public transportation. We actually take the train. We actually take the bus, because 50% of the folks in the city of Newark do not even own a car. So a lot of us take those public transportations, and us being down 79% is huge. It means that we are, in fact, doing what we asked to do, and we're sheltering in place. Workplaces are the same. Like, people going to work is 45% down in the state and in Essex County. We down both 45%. Which, look, y'all, I want to thank you guys for doing that. You know, I started off with the article about the Spanish flu, and it showed you how cities who did what we're doing now avoided a very, very, very huge death rate. They didn't avoid deaths at all. They just avoided a huge death rate in comparison to other cities. So what we're doing is actually saving people's lives. So I want to thank everybody that's listening, that's participating, that's doing what they're supposed to do, that's wearing a mask, that's socially distancing, that's staying home, that abided by and listened to our Be Still Mondays, and all of the businesses that are now catching on and being a part of the Be Still Mondays. We thank you for putting our health above your wealth. I appreciate that. So here's the numbers. In Newark today, we have 3,247 positive cases in Newark. 3,247 positive cases. Yesterday we had 3,079. 3,079. So you see the numbers that we're still moving up, but not as great as we were moving up. 3,247 positive cases. Deaths, 192 deaths today. 192. Yesterday we had 181. 192 deaths. 192 deaths. That means that there are 192 families that are grieving because they lost their loved ones to an invisible virus, right? A virus that causes a disease, an upper respiratory illness, right? So 192 families, pretty tough. In New Jersey, we have 71,030 positive cases and 3,156 deaths. 3,156 deaths throughout the state. So let me go over these zip codes for you. So I want to tell you this too. Out of the 619,000 cases in the United States, more than 51,000 people have recovered. So I know there's this whole line of folks on here saying, tell us who recovered. There are a lot of people recovering, a lot of people even recovering in Newark and people recovering in the state. There's still too many people dying, right? And our job is also to protect them, not just ourselves. Zip codes, 07102, 127. 07102 has 127 positive cases. 07103, 395 positive cases. 07103, 395 positive cases. 07104 still leading the pack, 660 positive cases. 07104, 660 positive cases. 07105, 411. 07105, 411. 07106, 367. 07106, 367. 07107, 476. 07107, 476. 07108, 261. 07112, 276. 07112, 276. And 07114, 119. 07114. Now I told you before that 07104 and 07107 border each other, right? So they border each other. And so if you add 660 with 476, that is a huge amount of the numbers that we actually have. And so if you live in those areas, please, you should take, all of us should take precaution, but you folks should take extra precaution. That's for sure. So I want to talk to you about when you can get out of this quarantine, right? Not that it's over and we going outside. These are for people who have tested positive or who have had symptoms and they're wondering how long are they contagious or how long do they stay out. I read some stuff yesterday. I just want to make sure that I'm clear on it today. I'm going to read it again to you today from the CDC. So you can go to the CDC website and pull it all down too. We try to simplify it for you. If you had close contact, at least 10 minutes, close contact, at least 10 minutes with a COVID-19 plus person and you were not tested, you had contact with somebody that you know is positive, but you were not tested, you have to self-quarantine. That means stay at home. That's what self-quarantine means. It means don't go outside for 14 days, 14 whole days, not 11 days, 2 days off, and then another day after that, 14 whole straight days. And if no symptoms, if you don't have any symptoms after those 14 days, you can end the self-quarantining piece. But I would, if you live in Newark, you still have to wear a mask and gloves when you come out your house, and you have to be careful of being around your family. In my mind, if you in fact had symptoms and were tested, you had symptoms and you were tested, and no follow-up tests, which will most likely not happen, right? You must quarantine. Oh, excuse me. Well, people are getting ready to start doing it now. They're going to start testing you twice. So if you had symptoms and were tested and there was no follow-up test, here's the things that you should be doing. Obviously, you have to quarantine. but at least 7 days from the beginning of your symptoms. So the beginning of your symptoms, you have to begin quarantining from 7 days at the beginning of your symptoms. If you don't experience any more cough, right? If your fever or temperature goes below 100 degrees, right? If your temperature goes below 100 degrees, that's without using Tylenol or Motrin, and it has to do this consistently for 3 whole days. So if your temperature goes below 100 for 3 whole days without Motrin or without Tylenol, without any other medicine that is assisting you, then you are in the clear. If you had a positive test, and never had symptoms, like you're asymptomatic, you're walking around here, no chest pains, no cough, no shortness of breath, no fever, but you had a test and you were positive. And more than likely, you probably got that test because you were around somebody that was in fact positive. But if you positive test and no symptoms, you must quarantine for 7 days. You have to quarantine for 7 days from the time of your positive test. Then you can stop quarantining. So if you test positive and you have no symptoms, you have to quarantine for at least 7 days. If you still have no symptoms after those 7 days, then you're free and in the clear, according to the CDC. But if you live here, you need to come outside with a mask and gloves on. I saw a young lady at Walgreens today with no mask. I tried to give her a mask. She said, "Oh, thank you. You're so nice." No, I wasn't being nice. I was trying to protect myself from you. Everybody needs to get a mask. In fact, I'm going to tell you what we're doing. The city is, in fact, handing out masks. And I told you the easy way that you could get it done for yourself. But the city is also handing out masks. So before I get to that, I want to share with you the CDC recommendations for essential employees. If you are an essential employee and you're at work, right? Your boss has to provide you with gloves and masks, right? They have to, at all times. You have to practice social distancing in your workplace at all times, right? At all times. In break rooms that you have where you go break, they cannot be crowded. It has to be social distancing in there, right? If you start experiencing symptoms at work, you should go immediately home. You should go home immediately. Don't share headsets. Don't share objects that are near mouth and nose. Don't do it. Your temperatures at work should be taken either every day or periodically, but we suggest that they take them every day, daily, before you start work. Temperatures should be taken all the time. There should be increased frequency in the cleaning of your buildings or wherever you are. The disinfecting of the common areas where all of you guys sit at. People that are sick should be sent home immediately. People that are sick should be sent home immediately and should not still be hanging around. They should send them home. If people are sick and the boss is not sending them home, I would advise you to report that, right? Because you should not be around sick people, particularly if you shouldn't be around sick people at all, especially if they don't have no mask and no gloves. You need to get out of there. 100% you need to get out of it. WIC office. I'm saying it again because people have been asking me about WIC, right? So WIC office is open Monday to Friday from 8:30 a.m. to 4:30 p.m. by phone. It is open to the public on Tuesdays and Thursdays. Open to the public on Tuesdays and Thursdays. An appointment is recommended. Phone number is 973-733-7604, 973-733-7604, 973-733-8198, 8198. Those are the 2 numbers for the WIC office. All of the services from vital statistics, social, all of the things that you usually get out of homeless services, FQHC, all of those things are open and available. Please call and get an appointment. The Shani Baraka Center for Domestic Violence, still open. Call and get some help, some advice, figure out how to do things online, and get some help. They'll all be open at least 1 or 2 days a week as well. So call and get that information. Also, go to the city's website, www.newarknj.gov, www.newarknj.gov. Go to the website for COVID-19 help. Click COVID-19 help, right? You can get information ranging from Be Still Monday, sheltering in place, eviction and foreclosure moratoriums, federal and state and local programs, emergency grants and loans for small businesses, food distribution, which is still happening, free meals for students, unemployment benefits, and much, much more. I know we talk a lot about unemployment. On Friday, we're going to have the State Department of Labor Commissioner on our Facebook Live with me, talking just about unemployment and some other things. There's going to be some other people with him talking about other things. Rahman Muhammad is going to be there. There's going to be a whole bunch of a slew of people. I'll go down the list in a few minutes, but important to you is the Department of Labor. The Commissioner of the Department of Labor will be present. He'll be able to and we're going to be able to answer questions regarding unemployment, because I know it's been difficult for a lot of us to get through on this unemployment stuff. The IRS, let me show you. This is the IRS website. This is, if you go to Google, you type IRS, this is what comes up, right? This is what comes up. This is the IRS webpage. This part right here, let me get this right. I'll do this. Right here. See this with the dollars? That's the part that's what you want to click. You want to click that. That is the economic impact payments. And it shows you very clearly how to get those payments, how to see if you're eligible, how to get extra money, how to make sure if you didn't file tax returns, what to do if that didn't happen. But some of you may still be eligible even if you didn't file a tax return, but most of us have to fill out a tax return of some sort. So make sure you go to that and do that. It's incredibly important for us all. Some more support for small businesses. I talked about it yesterday. Please email capitalconsulting@investnewark.org. Capital Consulting, one word, @investnewark.org to get information about technical assistance around grants and loans for small businesses that have been affected by COVID-19. Please don't forget to do that. Now this Friday, we're going to have Congressman Albio Ceres, we're going to have Congressman Donald Payne, and we're going to have the Commissioner Robert Asaro Angelo, the Department of Labor. The Commissioner Robert Asaro Angelo and Deputy Mayor Rahman Muhammad. Donald Payne and Congressman Ceres too. We're going to be talking about everything COVID-19, specifically some of the things that the federal government is doing, and around this whole issue of unemployment. So please make sure you tune in. We're also giving out masks. Now I'm going to tell you where we're giving them out at if you need a mask. So we don't have none of these excuses about I don't have a mask, right? They grab and go. You got to come grab it and get out of there. It starts Friday and Saturday. It's going to be Friday and Saturday, April 17th and April 18th. First come, first serve. You can't call and reserve no mask. April 17th and April 18th, Friday and Saturday. That's what we're doing right now. Those 2 days for now, from 11 to 3. From 11 to 3, Friday and Saturday. This Friday, this Saturday, from 11 to 3. You have to live in Newark, and they're going to ask you for some sort of identification. You got to live in Newark. So if you live in the Westward, you can go to Speedway Avenue School. Speedway Avenue School at 701 South Orange Avenue. Kevin Waters will be handling that. The Central Ward location will be at 271B South Orange Avenue. 271B South Orange Avenue. Al Tariq Anque. 271B South Orange Avenue. In the South Ward, you go to Weequahic High School. That's on Chancellor Avenue. Weequahic High School on Chancellor Avenue. In the East Ward, you go to Eastside High School. Eastside High School. Eastside High School. Angela Williams will be taking care of us down there. North Ward location, Vince Lombardi on Bloomfield Avenue. Vince Lombardi Center, Carlos Cruz. This is where you go get masks from 11 to 3, Friday and Saturday. 11 to 3, not 9, not 10, not 5, not 6, 11 to 3, Friday and Saturday. That's it. Not Sunday, not Thursday, not Wednesday, just Friday and Saturday. Go there and get a mask if you need one, or you can just make one in your home. Please, I need you to do that. I want to make sure I shout out Marcus B and P that have been providing food every single day to our first responders. Marcus BP downtown. When this is over, y'all, and even if it's ain't over, find a way to support Marcus B and P for supporting our first responders, y'all. They're making almost 100 lunches a day for first responders. We need to support them. And Calandra's Bakery. Calandra's Bakery has been helping us out as well with lunch and dinner for 4 weeks straight. Lunch and dinner. Calandra's Bakery. Shout out to Calandra's Bakery. We love you. We provide lunch and dinner 4 weeks straight to all our EOC folks, all our emergency operation folks. We appreciate you, Calandra's. Shout out and support Calandra's when you get an opportunity to support them as well. I'm not done. I got a couple more things and we out of here, y'all. Tonight, online, folks, online tonight, because everything is online, that we're having a big poetry series, the beginning of a poetry series tonight, right? So we need you to participate. I'm gonna give you the information. It's tonight at 8 p.m. You could go to the Newark Public Library website or the City of Newark's website, right? We're gonna have a live poetry reading going on in sponsorship with us, and it's being done by the great poet Jasmine Mans. The great poet Jasmine Mans. We need y'all to be on it. The mayor might get on there tonight and read a poem. So I might read one of my own poems, not somebody else's. But right now, just want to read a little bit, very brief, from Toni Morrison. Toni Morrison said, "This is precisely the time when artists go to work." Let me say that again. This is precisely the time when artists go to work. There is no time for despair, no place for self-pity, no need for silence, no room for fear. We speak, we write, we do language. That is how civilizations heal. Shout out to the poets, y'all, and the poetry. See y'all tonight, Newark Public Library, City of Newark website, Jasmine Bands, Poetry Live. Thank you for tuning in with us. I'll see you guys tomorrow. God bless.